Hi. Okay, what I've got going on right now is, okay, you can see I have a neck collar on. It's because I can't hold my neck up today. That's from Dystonia. It gives out. I can't hold my, no, I shouldn't say neck. I can't hold my head up. I keep saying neck. Well, I can't hold my neck up either. I don't know why I'm laughing right now because I'm in a hell of a lot of pain. Also today the trunk of my body gave out, which it does frequently, at the base of my spine, and I have loads of herniated discs that don't get a chance to heal because it keeps happening, or I paralyze backwards from dyskensia or dystonia down my back. That's what I wanted to get. That's oral. I don't get it a lot, so I wanted to get it on the tape. I'm having trouble sitting up right now because I'm in a lot of pain, and my herniated disc is herniated and re-herniated. I don't know how many are herniated. I know there's one real bad one, right where it gives out, but I've had, I think, up to three or four. I know at least three. Anyway, I don't get that's called oral dyskinesia. There's other kinds of dyskinesia they're movement disorders. The dystonia can be a movement disorder as well, but it's also more related to cramping. I have both, and the full body convulsions. So I also have gotten that with my lips, my smacking. When I have seizure activity, when I went through years of really severe seizures after coming off 8 years of a lot of psychotropic drugging, 99% I didn't need. If alternatives had been used, I probably I would have needed very little. I just needed my central nervous system to be brought down. And a sensory overload, which was at first focused on. But anyway, I'm having a really hard time sitting up right now. So it just started to happen, so I wanted to get on, because I don't get it a lot. And it was confusing in the beginning because it would happen, I'd get it when I had really bad seizures as well, lip smacking. Except it would be for a long time. Where with the TD, oral tardive dyskinesia, I usually get it for shorter periods of time. I don't know if it's going to come on again. What I'm going to do is I'm going to take a little bit of clonazepam. I don't have the right medications for all the dystonia. I have generalized spasmodic dystonia. That means groups of muscles cramping all through my body. All my muscles and ligaments are damaged underneath, short and stiff, from another drug reaction. I've had acute dystonia, lead pipe dystonia, and the acute dystonia started all damaging my muscles and ligaments in the trunk of my body, and also starting the full body slower rapid jerking, which is very well described under myoclonus dystonia if you look it up, except it says it's genetic, and mine started with medication. So I was told by a psychiatric nurse that was sent into my home that it was a weird kind of full-body dyskinesia. But they put down on the records to cover for the doctors and hospitals that was purposely controlled movements. Those movements I wake up to every day. So there goes again. I've seen a video of this on YouTube of somebody. She's getting treated properly for it. She was on clonazepam, which is fatiguing. I get anger and hostility on it as well. Depression, and it clogs my lungs. And I need actually a much higher dose than I am on. And I was repeatedly cut off. I was cut off everything in 2004. But they gave her Valium. That helps. Has to be a lot helpful for the dystonia as well. I also have severe ME, myalgic encephalomyelitis, which is sort of what got me into all this trouble, being sent to a psychiatrist for neurological problems. I didn't have that much depression. And most was related to having severe PMS and hormonal problems during my cycle after I got ME, and when I crashed, which they actually thought at the beginning was being bipolar, because they thought me being crashed and not being able to do anything and my mood going down, and then being unable to get up and function around the home was bipolar. Psychiatry for you. Pseudoscience. Can't help to get some of my own dialogue in there, eh? Okay, I'm going to shut this off now. I'm having, I was hoping to do some typing today in the living room, but I'm in horrendous pain just trying to sit up, so I have to lay flat. Last fall and through into the winter, I had so many disc herniated, I couldn't sit up. I was able to make it to the, I could, because I could make it to the bathroom. I do have a bucket and a female urinal in here, and I was forced to use them for so many years, left paralyzed in my bed alone. I'll crawl, drag myself to the bathroom, which is actually a dangerous place for me to be, because my neck and trunk of my body can give out at any time, and I can start convulsing, which I do. I wake up to every day. It's just variations of how severe and whether I can get it under control or not. And I just got some medications in May 2010 that I was cut off in June. Oh no, in fall 2004, but they aren't the right medications, so I have a long ways to go. So, my movement disorders are building up. That happened with the benzotrophine. That was drugged to reverse the extent of the severe muscle ligament damage, and then I was given amantadine with it, which caused, it's called lead pipe dystonia, which you can see in the green video, the second green video, except my arms were frozen in the air before that as well. Yeah, like lead pipes. I'm still rigid a lot of times. It's not that noticeable, depending when I'm on or even eating. There's amino acids that affect me really adversely and cause me to be more rigid. I had that movement disorder in my arms as well. And it started with the benzotrophine. I have a really strong tremor in my right arm that got worse when the dystonia got really bad, when after January 2004, when the first time I couldn't hold my neck up, the cervical dystonia had gotten really severe. I was on the medical records, but they left it off as a diagnosis. I've been cleared and riddled with it for a long time. It actually started in the late 90s. I just didn't know what it was. Okay, I can't sit up anymore, so, and I'm even having trouble holding up this pole for the camera. It's hurting. My muscles and ligaments on my arms are, to my wrists, are extremely damaged. Well, they all are, but they're the worst of the lot. In my shoulder sockets, in my spine. Still, I can't lift up much more than a book. Sometimes I can't even lift up that. So right now, this is even hurting my shoulder sockets and my arms, and I can't do this anymore. So I have to take some clonazepam and lay down, and I'm trying to think what I can take for the pain. I've already taken a quarter of a Percocet, and it's not doing anything. If I take more, it makes me more rigid since I got dystonia. So I have to be careful how much I take, and I used to be prescribed 3 to 4 a day. I just got those back in May, and just only a few every few months. So I actually need something that's going to relax the herniated discs and muscle spasms and my shoulders, but then I don't need my neck relaxed anymore, because then that might cause me not be able to hold my neck up longer, and the trunk of my body give out again. It's a herniate my disc, and also if I paralyze backwards, it herniates my disc, which that's almost every day. Okay, let's turn this off. Cheryl Benson coming at you from bed, neck collar and all. Have the best day you can. Help me have the best day I can. See you soon.